Hi, this is Dr. Ann Maxwell. I'm a clinical psychologist and I'm a co-founder of Well Tended. And this is part 2 of a series that Dr. Kessler and I have put together to help parents when they have received a diagnosis of autism for one of their children. The first video we made was really about self-care, and it was reminder first of all that it's important for parents to make sure that their needs are getting met and that they're reaching out and getting useful support after receiving news that's very life-changing. And then we also talked about some of the things to take into account when you're seeking help and seeking support. So today, this video is really about what are the next steps after that? How do you make a plan for intervention once you have received the diagnosis of autism for your child? So the first question that parents might ask is, what kind of therapy should I do for my child? And what I would suggest is, first of all, is there something that was recommended by the person who did the assessment and the diagnostic evaluation? Because typically, when you get the diagnosis made, there are specific clinical recommendations that are made. So if there have been recommendations, then you can certainly turn to those. And if your child is under age 3, then you've most likely been referred to early intervention for an additional evaluation and for services. And those services can include speech therapy, occupational therapy, and developmental therapy. So those are available for the parents of a child with autism if the child is under the age of 3. In addition to that, many clinicians recommend that parents start another type of treatment, and probably the most common treatment in this country for autism is applied behavior analysis, or ABA. ABA is typically a home-based intensive intervention, although it can be clinic-based, particularly for older children, for school-age children, and sometimes it's a combination of both hours in the clinic and then hours at home. It's like I said, it's an intensive treatment, and it's empirically based, meaning that we have data to support how successful it can be with kids on the spectrum. And its aim is to reduce challenging behaviors such as noncompliance, tantrums, aggression, and to develop skills in a number of areas that include language and play and academic and self-help. So it's a comprehensive kind of treatment. What I and Carolyn suggest heartily is that parents do their own due diligence and go online, try to find out what you can about the different treatments, try to do some comparison. If you have a treatment that's been recommended, but you're wondering which provider to use, you want to do some research to find out how much training this person has had, and is the person who's going to be overseeing the treatment a clinician and not only like a behavior therapist. So we can provide more detailed information on our website for parents who have more specific questions about like how to kind of determine if you're finding the best provider for ABA in your area. It's also recommended, if possible, to talk to other parents whose children are receiving that kind of therapy, and if possible, that kind of therapy from that particular clinician, because then you can actually get a more accurate account of is this really helping? So those are some basic suggestions. And in the interim, because we know too that unfortunately there is often a delay between the time that the diagnosis is made and the onset of treatment. This might be because you're still searching to find the best provider, or maybe you're sorting out insurance issues, or maybe you found a provider, but there's a wait list. So there are things that you can do. We did mention early intervention, of course, but there are things that parents can do in small steps. And really, there's nothing that's too small to have a positive impact on your child. So there are things that you can do to support your child before you can begin like the proper, true, formal intervention. And you can think of it as you're not just making changes in your child, you're making changes in your patterns of interaction with your child. So we're going to go through just a few examples of things that you can do that may sound really small, but like I said, there's no step that's too small. There's nothing that's insignificant. And I encourage parents also to look on our website, because we go into much more detail about things that parents can do to support their child. So the first thing is simplify your language. And Carolyn and I have some videos on our website where we talk a lot about how to pare down your language, not just for kids with autism, but little kids that are having tantrums or that are dysregulated. They're not able to process information as efficiently when they're upset, when they're escalated. So we talk a lot in the trainings that we do about paring down the language and simplifying it. And this is enormously helpful also with your child with autism, because one of the core deficits of autism is in language comprehension. So if there's an instruction you want to give your child, you can strip it down to a more basic 2 or 3 word phrase. So instead of saying, hey, stop what you're doing and come on over here, you can say, come here, or sit down. You can use 2 or 3 word phrases that can be much more effective at helping the child understand what it is that you're asking of him or her. Routines are also really helpful. And I know that some families are more amenable to adopting routines in their household, and some aren't. I can tell you from my experience as a parent, my daughter's a teenager now, but to be honest, as a parent, I always found it hard to get a regular routine, even though I recommend it wholeheartedly to my clients. It's just something that took a lot more effort on my part to do in my house. But there is a big payoff if you have a fairly regular time when you put your child to bed, or when your child has a nap, or when your child eats. These things are very helpful. And you can also consider incorporating a visual chart with pictures to support what it is that you're having the child do during the course of the day. And again, I want to keep reminding you that we have a lot more information available on our website. Another thing that parents can do right away is do what we call mindful play. We all play with our kids, but sometimes if we can go into the play mindful of a goal, so we sort of have like a hidden purpose, then there can be a lot of teaching that we're doing just naturally, or what we call incidentally. So, for example, you could take a toy that your child likes and you could conceal it under layers of clothing maybe, and the game is we're trying to find the toy train, and is it over here? Is it under there? Is it next to this? And it's not rapid fire throwing questions. It's asking a question and then you're looking together, where might it be? The child might become frustrated because he might want that toy really badly. So you might, the game might not be very long. It might be like, we're going to look two or three places and then I'm going to help you find it. But it's a really nice way to get engagement with your child and to model problem solving. Like, ooh, is it under this? Let's look. And thinking out loud and showing the excitement of what your excitement as your child's play partner when the toy is found. So that mindful play is very powerful. Another thing we encourage is labeling, particularly if your child who's just been diagnosed has an expressive language delay, or maybe is nonverbal. So we suggest that you label basic objects, and you don't have to overdo this. You don't have to say chair, table, window, door, but maybe there's 1 or 2 things in an interaction or an activity that you're doing that you focus on labeling. And best to label things that are familiar, functional, basic objects that the child plays with or uses on a regular basis. So a spoon is a good example. So you could be playing with the spoon, or it could be at mealtime, and you're making a point of referencing the spoon by its label. Here's the spoon. Wow, look, the spoon. Here it is. The spoon is for eating. We eat with our spoon. You might feel silly doing it, but it's a teaching technique that can be very powerful. And another quick technique I'll tell you about is that we can pair sounds with objects in play. So if our child likes a train, maybe our child can't say train yet, but could we can label it as a train, but we can also add a sound that the child might be able to imitate and pair that with the play. So choo choo as we're pushing the train on its track, or we're watching our child push it on its track. We're modeling for the child the sound that goes with that, choo choo. Or if it's a car, we're making a vroom vroom sound. Or if you have a doll and she's going down a toy slide in like a playground scheme, she might be making a wee sound as she goes down. So there's a lot of sounds that you can pair. Same is true for animal sounds. You can use toy animals or stuffed animals and pair the sound that the animal makes, because often in language development, those are the things that we hear our child imitate first. So they may not say cat, but they start to say meow, and that's development of language. So we do have more strategies, more things that you can do as a parent that are meant to be easy to use. They don't take teaching materials per se. They're just things that you can create in play or in just doing any routine activities with your child. And we encourage you to check our website for more information. And we encourage you to let us know what we can provide additionally that would be helpful. Because we appreciate how overwhelming it is when you get a diagnosis of autism for your child. And we appreciate the adjustment that you are forced to go through and what your family goes through. And we're here to help. Thank you.